Okay, can somebody please confirm you can hear me?
We can hear you.
Thank you. Before we begin, are there any questions? Not hearing anything, so let's begin. Let me share my screen here. All right, you should be seeing my screen now. So today is October 23rd, and we're supposed to be talking about Lab 6, disc diffusion, and antibiotics. Any questions about any of that? Remember, I'll send you your unknown number and the first three tests this coming Tuesday. Lab 6, disc diffusion, evaluation of disinfectants and antiseptics, and antibiotic effectiveness. Any questions about this? As is normal, there is some reading for this lab. So please read page 177 of your textbook, page 187 to 194, page 196 to 197, page 554 to 555, and pages 567 to 569. These are all on topics involving this lab. There is a virtual lab for today. The learning objectives for this lab is one, be able to identify the type of chemical agent and the active ingredient used in various disinfectants or antiseptics. Two, evaluate the effectiveness of disinfectants and or antiseptics using the disc diffusion method, which is also called the Kirby-Bauer method or Kirby-Bauer method. Three, determine the mode of action of various antibiotics. Four, evaluate the effectiveness of various antibiotics using the disc diffusion method. Five, list the variables that influence the antibiotic disc diffusion susceptibility test. And six, define the terms. What's sterilization, disinfection, what's a disinfectant, what's an antiseptic, what is a bactericidal agent, what is a bacteriostatic agent, what is an antibiotic, what is a spread plate, and what is a zone of inhibition. Any questions about any of this so far? All right. Sterilization is the elimination of all viable organisms, including endospores. Usually in the microbiology lab, how we sterilize something is we put it in an autoclave, which is essentially a giant pressure cooker. Disinfection refers to the destruction of vegetative cells, but not necessarily endospores, meaning when you disinfect the toilet, you're destroying all vegetative cells, but you may not be destroying all endospores. Disinfectants are chemical agents applied to inanimate objects. An antiseptic, on the other hand, is a chemical agent applied to living tissues. So when we use chlorine bleach on the toilet, it is a disinfectant. But when we use, I don't know, alcohol or tincture of iodine on your injured cat, that is an antiseptic. That's not to say that you cannot use the same chemical for the same purpose. For example, at least one of the older treatments, I don't know if it's still a treatment or not, for necrotizing fasciitis was to put, oh, what do you call that, wrappings in bleach and then put it on the skin using bleach as an antiseptic for the necrotizing fasciitis. If you don't know what necrotizing fasciitis is, that's the flesh-eating black bacteria. So chlorine bleach can be used as a disinfectant and it can be used as an antiseptic, but usually a disinfectant is a more harsh chemical and it'll do damage to the skin, and antiseptics are a less harsh chemical and tend not to damage the skin. Like tincture of iodine does not damage the skin, but chlorine bleach will. And why did they use chlorine bleach on necrotizing fasciitis? Because the treatment was much less severe than the disease itself. And I don't know if that's still the treatment or not. It used to be a treatment for it, but that was back in the 1990s, and I just don't know if they still use it. To evaluate the effectiveness of chemical agents, the surface of a nutrient agar plate is inoculated with a particular species of bacterium. Paper discs saturated with different chemical agents are then applied to the surface of the agar. The chemical agent diffuses into the agar, establishing a concentration gradient around the disc. You then overnight incubate the plate and observe the bacterial growth pattern around the disc. If there is a zone of inhibition, an area of no bacterial growth, then the chemical agent can be assumed for that particular bacterium to be at least a little effective because there is a zone of inhibition. Conversely, if there is no zone of inhibition, the chemical agent is assumed to be ineffective. Now, notice I used the word effective here. I didn't say the bacteria is sensitive or resistant to that agent. And we'll talk about those terms later in this lab. Here is a table of common disinfectants and antiseptics. The disinfectant or antiseptic in this column, ethanol and isopropanol, most other alcohols, they're a real weak antiseptic or disinfectant, and we usually call them a de-germing agent because they really do not disinfect an object or what do you call it, antiseptic the object. It's because it's so weak, there's a lot of cells still living, but we do use an alcohol swab to de-germ the area of your skin when you're going to make a puncture wound with a needle. And the de-germing just reduces the microbes to a relatively safe number, so then you can give the needle stab and then inject something in the needle. Anyways, that's ethanol and isopropanol. Formaldehyde, formalin, and glutaraldehyde are disinfectants, and they're real good disinfectants too. They actually kill endospores. There are not too many disinfectants that do kill endospores. There is another. Let me scroll down to it. Peroxygens, although it doesn't say that there. A peroxygen is a ingredient that is something like hydrogen peroxide using oxidation to kill the cells. And it's a real good antiseptic because it can kill vegetative cells and it can kill endospores. Like I said, there are not too many disinfectants or antiseptics that kill endospores. And peroxygen, or hydrogen peroxide, is an antiseptic that actually kills endospores. The aldehydes are actually a disinfectant because you really want to use formalin or formaldehyde on your skin, but you can use it as a disinfectant. Halogens include iodine and chlorine, like chlorine bleach, tincture of iodine. Iodine is an antiseptic because it doesn't damage the skin. The chlorine bleach is mostly used as a disinfectant because at least long-term use would damage your skin. Heavy metals like mercury and silver were not used for a while in, well, medicine, but their use has come back because of the resistance of bacteria to antibiotics and other antiseptics. And so now they will put a heavy metal like in um, dressing or on a very gauze type band-aid, and the heavy metal is included to prevent the growth of bacteria. But you should realize heavy metals are toxic to humans, and so you don't necessarily want a large exposure of heavy metal to you, although on your skin it's okay, but you wouldn't want to consume it or get it like on a mucous membrane, something like that. Phenolics, phenol compounds, these are actually the first disinfectants that Joseph Lister used, and they're antiseptics in low concentration and higher concentration, they're disinfectants. And then surface active agents like quaternary ammonium compounds, a disinfectant sometimes used in hospitals. I don't think quaternary ammonium compounds are ever used in a house, but they're used in, well, like medical facilities and maybe industrial facilities. All right, the zone of inhibition size around the disc on a plate depends only partially upon the sensitivity of the organism to the disinfectant or the antiseptic. Various other factors affect the zone size, including the concentration of the chemical. If there's more chemical present, you generally will have a larger zone of inhibition. The molecular weight of the agent will affect the zone of inhibition. The larger the agent is, the less it will diffuse in the agar, so the smaller the zone of inhibition. And then the density of the bacteria inoculum can also affect the size of the zone of inhibition. Let me see if I can remember this. The more dense the bacteria, the smaller the zone of inhibition. So evaluation of antibiotic effectiveness, and we'll use this talking about antibiotics, but realize you can use the method we're going to talk about, the Kirby-Bauer method, for other purposes, like testing the effectiveness of disinfectants. But antibiotics are categorized as bactericidal if they kill the bacteria, and bacteriostatic if they only inhibit the bacteria's growth. If you only inhibit the bacteria's growth and then you stop applying the bacteriostatic agent, the bacteria may regrow. Whereas if you apply a bactericidal agent, that will kill the susceptible bacteria and they will not grow. If we have a bacteriostatic antibiotic, we are relying on the antibiotic to stop the bacteria's growth, and then we're relying on the host immune system to remove the bacteria from the patient, because the antibiotic will not. It only inhibits the growth of the bacteria. When bacteriostatic agents are used, the immune system assists in eliminating the infection. All right, so the disc diffusion method is also called the Kirby-Bauer method, after the two doctors who, I guess, invented it, and it's commonly used to test for antibiotic susceptibility testing. The results of such testing help physicians in choosing which antibiotics to use when treating a sick patient. And bacteria are isolated and put on an agar plate, and then filter disc impregnated with an antibiotic is applied to the surface of the agar. Oops, sorry. Trying to get to the picture here. There we go. Let me blow that up a little. the antibiotic will establish a zone of concentration around the disc, and some antibiotics will have no zone of inhibition like this one and that one. Others will have a slight zone of inhibition like that one, and maybe that's kind of slight too. And then others will have a large zone of inhibition like that one or that one. The zone of inhibition happens when the antibacterial agent is at a concentration high enough to prevent the bacteria growth. It may or may not kill the organism, depending on what the antibiotic is and how it works. Like penicillin G generally creates a zone of inhibition, at least for gram-positives, which will have no viable bacteria within the zone of inhibition. So it is a biocidal antibiotic. Any question about any of that? All right, what was I wanting to talk about here? Oh, when we do the Kirby-Bayer method, it's actually very good for testing a patient's, well, the bacteria infection sensitivity to the antibiotic, because when you give an antibiotic, the antibiotic has to diffuse from the blood out into the tissues to go find the bacteria and then kill it. And that's very similar to the antibiotic diffusing out of the paper disc through the agar. And that's why the Kirby-Bayer method is very good for testing antibiotics. It is actually not so good for testing a disinfectant, because we're really testing the disinfectant's ability to diffuse through the agar. And when you apply a disinfectant, you disinfect the area. It's not diffusing when you apply it. So it isn't as good at testing a disinfectant as it is for testing an antibiotic. Any questions about any of that? And the main reason is simply because an antibiotic has to diffuse through a patient's blood, through the tissues, to get the organism it's trying to kill or inhibit. And a disinfectant does not diffuse. You apply it to the surface you're trying to disinfect. And then let's talk about the size of the zone of inhibition. Is this large zone of inhibition, is this bacteria sensitive to that antibiotic and resistant to this antibiotic? Or is it simply that this antibiotic is much larger in size, and so it diffuses through the agar less than this one, which is much smaller in size? Like I said, when you take a look at the zone of inhibitions, there are several factors coming into play determining the size of the zone of inhibition. And the number one is, of course, the sensitivity of the bacteria. If the bacteria is more sensitive to the antibiotic, you will have a larger zone of inhibition. But then again, if the antibiotic is smaller in size, then it will be a larger zone of inhibition than an antibiotic which is larger in size, because a larger molecule is going to diffuse through the agar less well. Any question about any of that? All right, so we can say that this antibiotic and that antibiotic is effective against the bacteria because there is a zone of inhibition, and then this one here is not effective because there is no zone of inhibition. But you cannot say that this bacteria is sensitive to that one and resistant to that one, because we have to then look at the size of the antibiotic, meaning its molecular weight, and then take that into consideration as well as other factors that can affect the size of the zone of inhibition. Any questions about any of that? All right, so the inhibition zone size is dependent on several factors: the diffusion rate of the antibiotic, the degree of sensitivity of the microorganism to the antibiotic, and the growth rate of the bacterium. Table 6.2 lists the procedure required to standardize these variables when performing the Kirby-Bayer diffusion method. So 1, you inoculate the nutrient broth using several bacterial colonies isolated on a non-selective media, and the nutrient broth is not grown for more than 24 hours old, meaning the cells are really freshly grown. And then you adjust the broth turbidity to 0.5 McFarlane units. That is approximately 1 times 10 to the 5th cells per mil, or 1 times 10 to the 5th bacteria cells per mil. You then inoculate a plate at room temperature, and the plate will have Mueller-Hinton media in the agar. And the pH of that Mueller-Hinton plate will be between pH 7.2 and 7.4. So that's to standardize the pH, standardize the media it's grown at, standardize the temperature that you're doing this, setting up the test at. And then the agar has to be a depth of 4 millimeters, because the depth of the agar affects the antibiotics diffusion through the plate. The thicker the agar, the less the antibiotic will diffuse. And then the plates are always 150 millimeters large, just to standardize the plate. And then you apply, using a non-toxic swab, the bacteria on the surface of the plate to obtain confluent growth, meaning you swab the plate everywhere, so you get a lot of bacteria growing on the plate once you incubate it. We haven't incubated it yet. But after you put the bacteria on the plate, you then wait 5 minutes to 15 minutes before you put the disc containing the antibiotic on the plate. And you put the disc at least 24 millimeters apart from each other, and use no more than 12 discs per 150 millimeter plate. And make sure you put the disc on between 5 minutes, but no longer than 15 minutes after you've inoculated that plate with the bacteria. So what you're doing is you're allowing the bacteria to get settled on the plate, and the 5 to 15 minutes will also be long enough to absorb the media or the liquid you put the cells on the plate. And then after 5 minutes, you put the disc on. But before 15 minutes, meaning you put the paper disc on between 5 minutes and 15 minutes. You then incubate the plates in a non-CO2 incubator for 16 to 18 hours, so we're controlling how long they're grown, at 35 degrees Celsius, so we're controlling the temperature we're growing the plate at, and you put the plate in the incubator no longer than 15 minutes after you add the antibiotic disc. Any question about any of that? So this is a highly standardized procedure for performing the Kirby-Bayer test. The reason why we use this procedure is so that we can eliminate variables that can affect the size of the zone of inhibition. And this way, if you use this procedure wherever you are in the world, you can compare it to someone else wherever they are in the world. And hopefully you'll have very similar, if not the exact results. Any question about any of that? All right, so then you incubate the plates and look at the zone of inhibition sizes. These zones of inhibition are then measured in their diameter using a millimeter. So there's the agar disc, there's a zone of inhibition. You take the diameter. Usually you take two diameters, one this way, one that way. It doesn't matter where the second one is. But, and then you take the average of the two in case the circle isn't perfectly round. If it's perfectly round, it doesn't matter. And then the bacteria is considered to be sensitive, intermediate, or resistant to that antibiotic when you compare the diameter to the table set up by the NCCLS, which is the National Committee for Clinical Laboratory Studies, discussing what is the sensitive size and what is the resistant size of this bacteria species to this antibiotic. And each bacteria will have a different size, and each antibiotic will have a different size as well. So, for example, the NCCLS has said for the bacteria Staphylococcus aureus exposed to penicillin G, if the zone of inhibition is less than or equal to 20 millimeters, then this Staphylococcus aureus strain is resistant to this antibiotic, penicillin G. However, if the zone of inhibition diameter is greater than or equal to 29 millimeters, then the bacteria, Staphylococcus aureus, is sensitive to this antibiotic, penicillin G. And in between 21 to 28 millimeters in diameter, you say that this bacteria is intermediate to this antibiotic. So it's not sensitive, not resistant, it's intermediate. Any question about any of that? So that's how you determine if a species of bacteria is sensitive to a particular antibiotic. You grow it up using the Kirby-Bayer diffusion method, then you measure the diameter and then compare that diameter of the zone of inhibition to the table set up by NCCLS, if I got that right. Yep, I did. Any question about that? All right, here's the terms for this lab. Know the terms. You can skip the references. While you're not going to be physically performing these activities, you will be responsible for how to interpret the effectiveness of antibiotics using the Kirby disc diffusion method, which is also called the disc diffusion method. And we do have a virtual lab in this lab for you to work on the Kirby-Bayer disc diffusion method. So here's a little video clip on preparing a spread plate, and then review the steps using aseptic technique when preparing a spread plate, putting down a bacterial lawn of growth. Let me show you how to do that. Pretend this is my plate. Hopefully you can see it. Let me take these out. Pretend this is a cotton swab. Pretend this is our stock culture of bacteria. What you do is you put the cotton swab in the liquid, and then you take the cotton swab and touch the sides of the sterile container, or the container that only has the one species of bacteria in it, and that's to get the worst of the liquid off the cotton swab. I'm not sure why I have that like that, but let's go ahead and keep it that way. And then you take your plate, and then you spread with the cotton swab everywhere on the plate to get bacteria to grow everywhere on the plate. Hopefully you can see this. Can you guys see that? Can anyone confirm you can see this?
Yes.
Okay, great. Then you turn the cotton swab a quarter of a turn, and you turn the plate a quarter of a turn. And then you repeat swabbing everywhere. Hopefully you can see this. And then after the second time, you turn the cotton swab a quarter of a turn, and you turn the plate another quarter of a turn, and then you swab everywhere. I'm doing it a little faster than I should. I might have skipped the Marys. And then before you finish, you take the cotton swab and you go around the edge of the plate. The reason for doing that is when you're streaking like that, occasionally you might not touch the very edge. So you go around and get the edge. And now you will have a plate of bacteria that will grow everywhere, and we call that a lawn of bacteria. I once had a student who she did something like this, doop 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 doop, doop 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 doop, and then she was done. And then she put her disc on the plate, and then she grew it up, and there are these vast holes in her plate where she hadn't swabbed. And she said, well, how can I measure the zone of inhibition? Because there's very large areas of the plate that have no growth on it. And I said, well, you didn't swab the plate correctly. You're supposed to get a lawn of bacteria. And I told her she had to repeat the experiment, or she could use her lab partner's results because her lab partner swabbed the plate correctly. So make sure you swab the plate everywhere, and then you're supposed to do it at least 3 times, just to ensure that you have bacteria growing everywhere in the lawn. Then put the cotton swab in the vial container, mini container containing bleach or the disinfectant, and write your initials and the date and the medium on the plate, the inoculum, perhaps the temperature, although you always grow that supposedly at the same temperature, 35 degrees. And then you put the antibiotic disc on, that's not there. Let the plate sit for a few minutes. Actually, you let the plate sit for at least 5 minutes before you put the antibiotic disc on, but you do not let it sit more than 15 minutes before putting the antibiotic disc on. And then you put the plate in the incubator, auger side up, meaning you put the plate in upside down and incubate at the correct time, which is normally, I think it's 16 to 18 hours. We in the lab always did overnight because we couldn't really do 16 to 18 hours because obviously one lab, essentially you come back, 24 or close to 24 hours later. So we didn't quite do that in the lab, but we attempted it. All right. And then let's go on to the worksheet here. So procedure 2, evaluation of antibiotic effectiveness. View the following video clips on preparing a culture for Kirby-Bayer diffusion method, and then view an interpretation of the results for Kirby-Bayer diffusion method, a little video, and then do the virtual lab on the Kirby-Bayer diffusion method. This may take a little while to load. I've got a fairly fast internet connection, so it doesn't take too long. And then this will come up. You're going to want to go through the start, but you can read the description, the steps, and the credits. But for this lab, you need to click the start, and there we'll see a plate containing E. coli, and a bacteria is the E. coli, and then there's a different antibiotic infused disc on the plate. TM stands for tropomyosin. I shouldn't have said that one. I'm not sure how that one is. TE for tetracycline. C for chloramphenicol. And then take the ruler here and let's go ahead and just do this one here. Put it so that the 0 is at the edge, goes right through the center of the disc diffusion. And that looks like it's about 31 millimeters for chloramphenicol. And come up here. And if you get it wrong, like that, you'll see a red X through it, that, a red X through it. If you get it right, it'll be green. So go ahead and do that. And you need to go through this to answer some of the questions in the worksheet. And then what you want to do, let's see, put that down. Oops, didn't mean to do that. Is click the menu again. See, this is E. coli. Click the menu again, hit restart, and it'll change the plate. So that's Pseudomonas aeruginosa. And it looks like a lot of these are totally resistant, like that has no zone of inhibition. But there's the chloramphenicol again. That looks like it's to 40. It might be 41 or 42. Let's go with 41 for CP, ciprofloxacin. There we go. And then do it again. So you need to do it 3 times or restart 2 times after you start it. Come on. And there we get a third plate, Staphylococcus aureus. And you'll notice that this strain of Staphylococcus aureus is resistant to all of the antibiotics except for VA, which is vancomycin. So this is actually MRSA, multi-drug resistant Staphylococcus aureus. And you can get the size of the zone of inhibition right here. There's only one, but about there, that's something like 16, 17. So it's sensitive to vancomycin. All right, any question about how to do the virtual lab? Let me get out of here. And then work on the worksheet. In table 2, we have some discs which we set up with the Kirby-Bayer disk diffusion method, and we're testing the susceptibility of E. coli to various antibiotics, ampicillin, cephalofithin, gentamicin, and tetracycline. In addition, we have the table from NCCLS about the zone standards for determining if the bacteria is resistant to the antibiotic or sensitive to or intermediate. And we're talking about E. coli and then these various antibiotics. I'll do the first one for you and then fill in this table here. So the name of the antibiotic, ampicillin, AM. The zone of inhibition is 15 millimeters, which you can see right here. Let me blow this up so it'll be a little more visible. So that's the zone of inhibition there. You measure from here to there using the calipers, but notice how we do not measure from here to there because the 0 doesn't start here, it starts there. What you use is from here to there. So this is measured as 15 millimeters. Is that clear to everyone? Or maybe a tiny bit less than 15 millimeters. And this one here will be measured from here to there, which is going to be 0 to 0. So this one would be 14 millimeters. Any question on that? All right, so for ampicillin, we have 15 millimeters, which is in the table here. So the zone of inhibition of ampicillin is 15 millimeters. The interpretation, come up to the table. Ampicillin, 15 millimeters is an I, so you put I or intermediate right here in the table. And I've done the first one for you. Do the next 3. Any questions about that? So fill in this table using the data above. And you must use the calipers as I explained how to measure with the calipers. All right. Question 3. List 5 variables that must be standardized when performing an antibiotic susceptibility test using the Kirby-Bayer diffusion method. And that was labeled in the table of the lab module, or you can just read the lab module. It's also in the lab module, in the text of the lab module. So put 5 variables that must be controlled in the Kirby-Bayer diffusion method. 4. Further questions. The size of the zone of inhibition often varies for 2 different species of bacteria when challenged with the same antibiotic. What is a possible explanation for these differences? 5. What would happen if we didn't use aseptic technique to put the antibiotic disc on the plate? Mention what will happen to our test results if we don't use antiseptic technique. 6. What would happen if we increase or decrease the concentration of the antibiotic in the disc? Be specific in your answer. So, right here, we have a given amount of antibiotic and ampicillin in the disc. I'm not sure what it is because I can't read that there. But what would happen if we put more antibiotic in the disc? What will happen to the zone of inhibition? And then what will happen if we put less antibiotic in the disc? 6. What would happen if we, whoops, I already talked about that one. 7. Antibiotics can be bactericidal, they kill the microbe, or bacteriostatic, they inhibit the microbial growth, but do not kill the bacteria. When observing a zone of inhibition around a disc, how would you determine whether the antibiotic causing that zone of inhibition was bactericidal or bacteriostatic? Like for this right here, is that zone of inhibition from the antibiotic bactericidal or bacteriostatic? This is a thinking question. Students often get this question wrong on the first attempt, but on the second attempt, most students do get the question correct. So think about it. Like I said, that is a difficult question, but if you think about it, you can come up with the answer. It's pretty simple once you come up with the answer. 8. When performing antibiotic sensitivity testing, it's important that the test conditions are kept very standardized, meaning we use the same kind of media, we use the same agar depth, we have the same age of the culture of bacteria. Why? Why do we do that? 9. Are there any other substances besides antibiotics we could evaluate using this method? Name a substance, meaning you must name at least one substance. I mean, you can't just say yes. You got to say yes and say, name the substance. And does the presence of a zone of inhibition necessarily mean that the bacteria being tested is sensitive to that antibiotic? Explain your answer. 11. From the size of the zone of inhibition of chloramphenicol on E. coli in the virtual lab, is the bacteria sensitive, intermediate, or resistant to the antibiotic? For chloramphenicol on Pseudomonas aeruginosa, P. aeruginosa, is the bacteria sensitive, intermediate, or resistant to the antibiotic? And let me check to make sure you have the here we go. Access to the correct worksheet, because it occurred to me I rolled it over from a year ago and I'm not sure when I changed this worksheet. Well, as soon as I find the worksheet, there we go. Yeah, you have question 11 on there. Okay, any questions? If not, I will be here until 3:45 to answer any questions and get started on the lab. If you have a question, make sure you ask before all the students log out, because once all the students log out, I'm going to log out as well.
I just had a question on the infectious disease paper.
Uh-huh.
I actually contracted ringworm before and I have my own pictures of it, like on my scalp.
Uh-huh.
I use those as like a reference.
Were you given the topic ringworm from me?
Yes.
Okay, yeah.
How would I cite that?
Um, I think you do something like um put something like what do you call that? Your
Can I just,
name, personal, in
mm,
the reference, you say your name, the year, and that could be either the year you're submitting it or the year you took the photograph, and uh, and then say personal information.
okay, thank you.
Okay. All right. That's the complete reference. And then in the in-text reference, you just say something like um, your name and then the date.
Okay, thank you.
Okay. All right.